of the Jerusalem Press Club with Mohammad Darawshe, Director, Center of Equality and Shared Society at Givat Haviva, who will speak about the Israeli Arabs under the coronavirus, public health and politics. For those of you who are here for the first time, you can watch the previous webinars on YouTube. You'll get a link to this webinar immediately after, and it will be also on YouTube very quickly. We created a WhatsApp group for this series, so you can always be in the loop if you wish. Stay tuned to our next webinar later today at 6 p.m. with Minister Tzachi Hanegbi. I want to thank my colleagues at JPC for facilitating this webinar. Mr. Darawshe will start with a short introduction and then we'll open up for Q&A. You're on mute, so please type your questions on chat and Mr. Darawshe will answer them. The Center of Shared Society at Givat Haviva, which Mr. Darawshe runs, aims to build an inclusive, socially cohesive society in Israel by engaging divided communities in collective action toward an advancement of a sustainable, thriving Israeli democracy based on mutual responsibility, civic equality, and a shared vision of the future. Mohammad Darawshe served as co-director of the Abraham Fund initiatives and as elections campaign manager for the Democratic Arab Party, later the United Arab List. In 2008, he was elected as city council member in his hometown, Iksal. Holds a Bachelor of Arts from the Hebrew University in Jerusalem, Master of Arts in Public Administration from Hartford University, lives in Iksal with his wife and 4 children. Mr. Darawshe, please.
Thank you, Uri. I just completed the second master's degree in conflict resolution from Haifa University a few months ago. Thank you, Uri, for having me, and thanks for the Jerusalem Press Club for this partnership. I wrote an article which appeared actually a couple of days ago in Haaretz, the title of my article was, "How do you say Corona in Arabic?" And I wrote it in Hebrew so that it reaches the Hebrew-speaking Jewish public. By the way, I'm sweating because I was doing my exercise and I went into the shower and I just finished, and it's not Corona, don't worry. And it doesn't go through the computer. And so my purpose from Haaretz article was actually to raise awareness, but also to do some kind of warning signal, to send some warning signal, because there is a gap between the Jewish and the Arab community, one in the current spread of the disease. It's more it's more in the Jewish population, less in the Arab community, although we are beginning to catch up. I don't think it is a matter of better health in the Arab community, but it's a matter of a delay of entry of this disease into the Arab community. Mainly, we know this disease was imported by people that came from outside the state of Israel, people that visited were in the outside the country. And it seems that the share of the Arab citizens in the travelers community is less, and that is causing a little bit of delay. But the second reason is that it seems that this disease thrives more in big cities than in small towns. Almost 70% of Arab citizens live in villages, in single homes, while 70% of Jewish citizens live in cities and in building blocks. And the interaction between people is much more significant. The same thing with the culture of cafes and all these things. There's more eating at home, there is more social home network environment, and less of widespread socializing. And that seems to be slowing the entry or causing the delay. Now, that's a good news. The bad news is the preparedness. How prepared the Arab community for this disease when the outbreak becomes significant. And we're beginning to see significant signs. Just today, 2 cases were discovered, one in the town of Al-Fahim, and the second was a third patient in a town called Tamra in the north, which indicates that the sleeping sick people are beginning to wake up, and they're beginning to be more public and seen. Now, the preparedness of the Arab community in handling this issue is very weak, because most Arab municipalities come from weak economic background. The fact that there's very high poverty rate in the Arab community, which reaches almost 47%. 47% of the Arab citizens are below poverty line. It means that this is a population which is even exempted from paying city tax. So there's no self-generated income for the Arab municipalities from 47% of their residents. Second, there's no industrial zones, which generate usually almost twice more property tax to the municipalities. Only 28% of the income of Arab municipalities comes from self-generated income, while in Jewish towns, it is closer to almost 65%, which means that the Arab municipalities are dependent on what's called balancing budgets that come from the government, just to be able to provide basic services. And as such, they did not have the luxury of having budgets to train their staff properly for emergency situations. They've been doing relatively okay with providing basic education, basic cleaning services over the years, basic social services, but not in good preparedness for emergency situation, which seems to have been a luxury if you have money or not. And maybe there's a sense of dependency on the state, too much dependency on the state because of their weakness, inherited weakness over the years. Another point that is worth mentioning here is that many of the Arab municipalities, their staff is not usually the best staff there is. Often there is a lot of nepotism associated with appointment of certain professionals in the municipalities, and they would not necessarily bringing the best of the best to the jobs. So combining these two elements, I would say that the Arab municipalities are definitely not prepared when the big wave of the corona comes to us. And as I said, I think that we can calculate the delay with a matter of 2 to 3 weeks. This is not far ahead. This is 2 to 3 weeks behind the Jewish community.
But
in addition,
Mohammad Darawshe, you're talking about the municipalities, but what about the cultural attitude of the Arab sector?
Well, that also caused the delay. For example, this past Friday, although there was a call to prevent prayers in the mosques, I have 3 mosques in my town, and they were fully operational, not maybe at the full capacity, but 50% of the people went to pray. And those are the 50% that are not always watching the news, or the news is not made properly accessible to them. Information has been, and I must say, the last week has been significant improvement in accessibility of information in Arabic, but for the first 2-3 weeks, all the information was only in Hebrew, and people who do not consume Hebrew newspapers or Hebrew media, they tended to get either secondhand information, which used to be probably tilted one way or another, or affected by some kind of a comment by either an editor of one of the Arabic media stations. For some time, there was a feeling that this whole thing of the corona is a fiction, that the Arab community is not going to be touched by it, that it's the problem of the big cities, and it's not the problem of the average person. I think that now people are beginning to comprehend how serious it is and how significant it is. Now, the coronavirus hits the weaker people who are weaker in their health conditions, and here we know that there's a higher percentage of Arab citizens with diabetes and with high blood pressure than our percentage in the general population in Israel. So physically, the older population, people, let's say even 50 up, 50 plus, we have a higher rate of people with diabetes and high blood pressure and overweight than the average population in Israel, than the Jewish population in Israel. And that means that we have a higher risk population than the Jewish community. And that's why the social structures are beginning to also comprehend it. I mean, and the containment or the quarantine is not the same kind of quarantine. I mean, the quarantine is not a single home quarantine, it's more compound quarantine. That's what we're beginning to see. So it's me, my two brothers, and our mother who still lives with us in the family home. We have a wall around the house, so we have a quarantine, a small mini neighborhood of 4 homes. So it's a different type of quarantine. We do not go out. One person out of this population of almost 25 goes out to bring food for everyone. So the social structure one means that the quarantine habits are different, but also the interaction with the rest of the population is different. Now, regarding enforcement, and we know that we do also have people that refrain from listening to guidelines and accepting guidance from the proper authorities. We know that the police has, and not only the police, but many government agencies have neglected the Arab community for many years. And there is a problem of mistrust that was created between the police and the Arab community. And that's why they do not take the police and other government regulations as serious enough. It takes time until these issues actually sink. I haven't seen a police, for example, in my town. It's a town of 15,000 people. I haven't seen a police officer in the last 3 days. They have a local community policing station that is staffed 4 hours a day, 5 days a week. That's for 15,000 people. So the police presence is not proper and it's weak. And right now, I think that the villages, and that's where we are, we're in contained village, are secondary in the police preparation. So the fact that we're contained in villages means that it's good. It's easier to close the community in smaller groups. It doesn't have to be like Tel Aviv, you have 600,000-700,000 people, and you need to break it into quarters. But here the quarters are much, much smaller. They're self-contained smaller quarters.
There's a question,
so, yes,
there's a question here, Mohammed. How come, relating to the fact that in the beginning the information was mainly in Hebrew, not in Arabic, how come the Arabic press didn't translate it or didn't transmit it to the population?
Well, they were transmitting it, but you know, as I said, it got edited. So what's more important, what's less important. It was going through without any graphic design. So you just see text without any assistance. Many people understand the messages better when, you know, the reason they put graphics is to help people better understand or prioritize the materials. And at the beginning, it was being sent as a second-hand edited information without graphics. Yes, as I said, in the last 3 to 4 days, the Ministry of Health has been making significant, very good efforts in making this information accessible. So if there was a delay in information of about a week, 3 weeks ago, 4 weeks ago, now the delay of information is less than 24 hours. So it comes in Hebrew and it takes a day until it comes out in Arabic. You know, I would say that a day is not critical at this stage, but that gap is being closed significantly. The bigger fear is the infrastructure. There's no infrastructure in the Arab community to handle this issue, although we do have many doctors and many nurses. The percentage of Arab doctors in Israel is almost 23% of the doctors in the country, while we're only 20% of the population. We're also 28% of the nurses, and we're 35% of the dentists and 54% of the pharmacists. So we do have a significant manpower in health, But these are busy in the public health, in the general public health in Israel. They're not dedicated staff for the Arab community. They're doing what they should be doing, serving the population based on health needs and not based on ethnic identity needs, which, by the way, is creating an interesting phenomenon. The fact that they are in the forefront of a joint future between for Jewish and Arab citizens, I think this creates a more significant value of the Arab citizens in the eyes of many of the Israeli Jewish population.
Which brings me to another question, because we are facing not only the coronavirus crisis, but also a political standstill here, and we have seen the rise of the United Arab Party. You think that out of this coronavirus crisis, a new relationship might emerge between Israeli Jews and Israeli Arabs?
Well, I mean, if I would expand this a second time or another opportunity about the political scene, I would do that. But I think that the Jewish and Arab citizens in Israel have gone through three different phases. The first phase, we used to call it coexistence. And basically, the really touchy concept of Jews and Arabs being able to socialize with each other, and I call it hummus coexistence. We know how to eat hummus and enjoy each other's company, but it's usually 9 to 5 type of operation. After 5 o'clock, we go to our different unique, separate communities, and the social interaction stops after 5, after work or after basic needs are served. Then we went into, after October 2000, after the second Intifada, we went into a stage which I characterize as a stage of narrative debate, especially after the.
Can you come closer, a bit closer to the? Because the sound is not so good. Okay.
Okay. I have a window open, so I'll just close it 1 second. Sorry, maybe this is better now.
Yes.
Okay, so we went through the stage of what I would call the narrative debate. It came after the Oslo agreements, when we realized that maybe we are part of the conflict, but not part of the solution between the Israelis and the Palestinians. And we were trying to find our political status in Israel. And now we are more into what I would characterize as the mutual interest stage. And you see it in the presence of Arab citizens in the medical industry, a significant increase of Arab citizens in the high-tech industry. Just 5 years ago, we were 2% of the employees in high-tech. Today, we are 7% of the employees in high-tech. You see it at the universities. In 2003, we were only 3.5% of the student population at universities. Today, we are 18% of the student population in Israeli universities. And that's basically based on what I would characterize as interests of the general society of Israel. And as such, the state and the Jewish population creates space and capacity building of the Arab community. Once we recognize there's an opportunity, as in the medical industry, we go at it and we prove our capacity and skill, and then the state creates that kind of space. Now, still there is what I would call some kind of a glass ceiling for political partnership. And that political partnership, its peak was actually during the Rabin government between 1992 and 1996. Since then, we are going backwards. And most of the retreat happened during the last 10 years under Benjamin Netanyahu's government, who's used Arab citizens more as a scapegoat to express his anger, and sometimes even, I would dare say, racist type statements, to maintain and speak to his political base on hate tactics, and not necessarily mostly demonizing and delegitimizing our political partnership. So answering your question, or I do think that the more human interaction and proper cooperation and human one-on-one relations, the more those type of issues appear and surface, I think this does help form a better future. The question is always, can this crack the glass ceiling? And so with the center left, I think that the glass ceiling is cracked. With people on the right, not all of them, but the more radical right or the more ideological right, I think that the glass ceiling is becoming more and more of a concrete ceiling.
But I know you wanted to talk only on mainly on the corona, not on the political issues. But since we are here, do you understand the concerns of many Israeli Jews about some of the policies or attitudes or platform of the radical parts of the United Arab Party?
The joint list.
The joint, yeah, they're not so united, they're joint.
Yeah.
About, mainly about their attitude toward the Israeli-Palestinian conflict. I mean, they feel that they represent our enemies.
I mean, I understand the fear, because this way the Arab citizens are seen more as an extension of the enemy or potential fifth column. This does send the wrong message of integration and the wrong message of partnership. But as such, there are many people in the Jewish political scene that send the exact mirror messages to the Arab community. Specifically, we need to talk here about two groups. One, which is not in the joint list. I mean, those that actually call to completely boycott Israeli elections because they do not want to even recognize the Knesset and the political scene in Israel as legitimate. And this portion is about 10% of the Arab community. They include the Islamic movement, the northern wing of the Islamic movement, and a few more radical nationalist groups. And there's the less radical who are called Balad, and they have 3 seats in the Knesset right now. I personally wouldn't vote for them if they would stand alone. And actually, in the elections, in the September elections, they dropped to 2 seats only. So they are marginal in the Arab community, and I'm not sure they even represent the best interests of the Arab community. I think that they are more pan-Arab type of organization and less of a local organization. But I would say this, in a way, this does negate the public mood in the Arab community. More than 83% of the Arab public, I mean, this is recent information, research that was done by Professor Tamar Herman and also by Professor Gabi Solomon, no, not Gabi Solomon, I forgot his name, another professor, together with the Professor Nuhad Ali from Haifa University. More than 83% of the Arab public wants integrative engagement in Israeli society. They want integration, they want to be part of the government, they want to be part of coalition. Yes, the Arab community prefers a center-left government than a center-right government, but they want in, and they see their destiny and future as fully integrated Israeli citizens. That's not what those radical Arab politicians are saying. They're saying they're leading a different, opposite stance to that of the Arab citizens. But the problem, and that's why they keep getting some kind of support, is that they say there's no Jewish hand extended to us, that the Jewish political parties have also engaged in delegitimization. So even if we want to be in, they are not going to take us in. So from the right-wing politics, this has always been clear, that the Arab parties are not even counted as legitimate members of the Knesset. That was even made by a statement with the Prime Minister Netanyahu in an interview with Dana Weiss, journalist Dana Weiss, just less than a week ago. He said that when we count the members of the Knesset, we only need to count the 105 Jewish members of the Knesset, the Arab members of the Knesset, not only the radical ones, but all of the 15, not only the 3 radicals, but all of the 15, from his point of view, are not legitimate members of the Knesset and cannot be taken into consideration regarding forming a government or anything. And we also saw even worse kind of statements, even Minister Gila Gamliel, the Minister of Social Equality, came today against the appointment of an Arab member of the Knesset to head the Social Services Committee in the Knesset. I mean, this is not a ministerial position. This is not even an executive position. This is an oversight position, some kind of control position. I mean, this clearly
but
shows.
contrary to that, in the social media discourse, I see a lot of people saying if there was a Arab-Jewish list which contained the moderate parts of the joint Arab party, then many people would have voted for it.
I totally subscribe to that. I would vote for such a party, for example. And by the way, I also think that separatist Arab politics has is some kind of in a way it's creating the self-made glass ceiling, and the only way to properly engage is through the kind of joint lists. But the identity politics, in a way, keeps you as a separate identity, but also creates a self-made wall from proper integration.
So maybe you should start one, and if it happens, remember everybody, it started here.
Okay, I see a question from Barbara. The first one you dealt with. The second one is not the Hebrew press and international press is source for Arab television stations and newspapers and radio. Yes, but I think that in a way I also touched on this, Barbara. This means, as I said, there is edited information and there is delay, and it's not organized information. That's my perspective on this.
Okay, we limit it to 30 minutes exactly because people are busy. You must be busy. I want to thank you very much, Mohammad Darawshe, for this wonderful presentation.
Pleasure.
Thank you guys for.
You're welcome to share my email with on my phone. Happy to answer personal questions.
We'll do that. And stay tuned to our next webinar, 6 p.m. this afternoon with Tzachi and Edli. Thank you very much.
Bye-bye.